I'm Dr. Joshua Kays. I'm a general surgeon and surgical oncologist with Franciscan Physician Network, and I'm here to answer your questions about general surgery and the operations.
Why do I feel tired after surgery?
Surgery is really a planned injury to allow you to heal in a better state. So one of the things that happens is your body is going to divert a lot of energy that you would use for other tasks towards the healing process. So that's one of the main reasons that people feel worn down, tired, or a lack of energy after a surgery.
When should I get my energy back after surgery?
Yeah, that's a very surgery dependent question. If it's something very simple, like having something excised off your skin, it could be a day or two. If it's a major abdominal operation where you're having bowel resected or major hernia reconstruction, it can take a few weeks, even a month or two. You should be concerned your levels of energy are not getting back to normal basically at about a month after surgery from a major operation. And also you should be monitoring how are your levels doing. If they're not getting better, that's a concern. If they're just slowly getting better, but you do feel progress, it may just be that you're taking a little longer to heal than we expected.
Why do I have itchy skin after my surgery?
So there could be a number of reasons why your skin's itchy. One of the things we do, especially for males, is shave them. So as the hair grows back, that can be very itchy. Another thing that's done during surgery is you get a sterilization prep of your skin. Some people actually will react to that. So it could be a reaction either to the skin preparation or the adhesives that we put on the skin over the incision after surgery. Or it could just be the fact that we do cut some nerves, even if they're small ones going through the skin. And sometimes as those nerves heal and start to fire again, it gives an itchy or even a tingling sensation.
How can I minimize scarring after surgery?
Yeah, that's the million-dollar question right there. Really, following the wound care instructions by your surgeon is probably the best thing you can do. We know things like smoking, nicotine use inhibit healing, so that's going to lead to more complications with scarring and healing. And also just nutrition. Nutrition is extremely important, not only for healing inside or the site of surgery, but also the skin. So eating good, healthy, nutritious meals so that your body has those nutrients to heal is probably the biggest things.
What can I do about constipation after surgery?
Constipation can happen for numerous reasons after surgery. If it's that you've had a gastrointestinal surgery, it could just be that your intestine is kind of figuring out its new normal, is how I like to say it. And it's, you either had a piece cut out and reconnected. It's a new way of doing things, so the body can take a little while before it fully adapts to that. Another thing commonly we see is pain medication does cause constipation. So I recommend anybody who's taken prescription pain medication, narcotic pain medication, take a stool softener, take some kind of gentle laxative like a Miralax or some Colace to just help keep your bowels moving.
What is causing my gas pains after surgery?
So gas pains are very common after all surgical operations. They can be present for a couple of reasons. One, it could be because it's actually gas within your bowel that's just not moving along. And again, there's the over-the-counter things like simethicone or Gas-X, more commonly as people know it, that can help. Another reason you can have gas pain is when we do laparoscopic or robotic surgery, we actually insufflate the abdomen with carbon dioxide. We try our best to get all of it out after surgery, but unfortunately sometimes little pockets get stuck, and that can actually cause quite a bit of discomfort. The good news is it's carbon dioxide, so your body will absorb it and you'll breathe it out, usually within about 24 hours.
What can I do for gas pains after surgery?
One of the best things you can do is walk. Get up and move around, because we have a saying, the gut likes to be as active as we are. So if you lay around all day and do nothing, the gut's kind of going to sit there. Get up, move around, it can help move that gas through.
Why do my shoulders hurt after surgery?
And going back to that laparoscopic or robotic approach, when we insufflate or blow your belly up, with carbon dioxide to lift your abdominal wall off the organs. If it gets trapped in there and you stand up, the air is going to rise up and irritate the diaphragm. Now, the interesting thing about the human body is the same nerves that go to your shoulder go down to your diaphragm. Branches go each way, and we don't necessarily think we should be having pain inside our body, so it's kind of like our wires get crossed and our body interprets it as shoulder pain, but it's actually gas irritation on the diaphragm.
What can be done for pain after surgery?
So the very complicated question to answer right there. We know there's side effects of narcotic pain medication. Like you said, the constipation, even potentially dependence, the opioid epidemic that happened not too long ago, I think appropriately scared a lot of physicians and even people in general to try to get individuals off those strong pain medications as quickly as we can. We've also learned that using higher doses of things like Tylenol, ibuprofen can actually be very beneficial and give you a near narcotic-like response. Moreover, though, we're using what we call multimodal pain control, where we've learned that not every kind of pain is the same and they don't all respond to the same medications. So what we commonly do is we'll give you Tylenol, we'll give you ibuprofen, we'll give you things like gabapentin, or also called Neurontin for nerve pain. We'll give you the narcotics. We'll give you a whole slew of different types of medication that act on different types of pain. And typically with the combination of those, you can get off the narcotic stuff very quickly.
What should I know about my diet after surgery?
I do a lot of complex gastrointestinal surgery, so I get a lot of questions about diet. Some of my operations, I'll be very specific about what you can and can't eat, and what that is we want the part of the intestine that we worked on to be allowed to heal. So we might put you on a soft diet or a liquid diet if you've had stomach surgery, because we don't want big meals, we don't want the stomach to work hard. But even then, it really focusing on healthy diets. I say after you're healing, protein is one of your best friends, even if you're taking supplemental protein, because I like to think of them as the building blocks of the body. So if you don't have them, you can't heal. And when we know, going back to the tired and fatigue question, your body's churning through a lot of your energy and the protein that you've already had.
Why did I lose weight after surgery?
We can also see weight loss very commonly after big surgeries for that same reason, is your body's tapping into stores that it hasn't tapped into, so we see weight loss.
What about activity after surgery?
And that's going to be very dependent on the surgery you had and how extensive it is. If I cut a little mole off of someone's skin, I might say, do whatever you want, just be cognizant of that spot so you don't rip the sutures open. If I do a major abdominal surgery where I've opened the patient wide open, it's usually no lifting over 20 pounds and nothing strenuous for about 6 weeks. And the reason for that is we want that muscle layer to heal, because if it doesn't, then you end up with a hernia.
Final thoughts?
Everybody's journey is going to be different. We all know people who have had surgery, and it seems like 2 or 3 days later, they're back to their normal selves. They're living life like nothing happened. But I'll tell you, most of the patients I actually treat don't recover that fast. They kind of have their ups and downs. It doesn't happen in a day or two. It's usually over the course of a couple of weeks. But eventually, they all get back to their baseline. So it's just being patient, not getting frustrated, and listening to your body. If you're tired, take a nap. If you're feeling well, get up and move. Just kind of listen to your body, and as long as you're within the restrictions the surgeon set, you should live life.